There are a lot of people out there who don't know what naturopathy is.
That's right.
Maybe you can start off by explaining what is naturopathy.
A naturopath is a health doctor, in contrast to a medical doctor who is a disease doctor. We treat health rather than disease. We try and rebuild and restore health rather than cut out spare parts or whatever. That's a little bit cynical, but because there are times when, God help us if we had an emergency and we didn't have all the expertise that a medical doctor has. But on the other hand, the human body is practically infinite. And the study of emergency care does not provide us, and this was my discovery as a medical doctor, did not provide me and us with the means to balance off the body, biochemistry, get down to the causes, normalize the environmental factors that cause the disease, provide the body with the normal elements that it needs to rebuild itself. They use chemicals. We believe that chemicals can save lives. They'll perform, the medical doctors will perform miracles, which I no longer will do anymore. But on the other hand, we will bring people back to health and restore them to their high level of living and well-being and a happy life, this sort of thing, which no drug or no surgery, no x-ray could possibly do.
You say that you've never done, or that you don't do that anymore. I understand that you were a medical doctor some 25 years ago with, in fact, a successful practice.
Yes.
And you opted for naturopathy.
Yes.
Why did you make that change?
Part of it was the discovery that all of a sudden I realized we don't have all the answers. In medical school, I'm taught we do have all the answers. We're taught that there is nothing outside of medicine that has of any value. This is why you hear a lot of the criticism and ideas that anybody that isn't a medical doctor has to be a quack. It's just black and white. You know, it can't be one of the, either has to be one or the other. We're taught that medicine has everything that is known that can help the human body. I stumbled across vitamin therapy for starters, which I found was very inadequate, and I started going from there into the whole field of nutrition. At the time, I had a lot of illnesses myself. I had 10 conditions which, according to the medical books, were actually uncurable. Not all deadly, but still uncurable. And I tried some of these on myself. I started feeling better. I started traveling. I started finding out that everywhere I went, there were all kinds of answers that did not come in the medical books. They were not answers that were good, any good at all for handling emergencies or crisis conditions or working in hospitals, and therefore if they don't apply to that field of work, then obviously they're no good, according to that standard, which makes sense. But when it comes to rebuilding health, I found all kinds of other answers. So as I looked at it, I found an idea that I thought had made sense, and I'd like to share it with you. And I have my way of expressing what a naturopathy is, or what a naturopath is. And I say it this way, a little bit facetiously, that we go back to nature in everything. We study the nature of the person. We like to treat people rather than problems. We study the causes of the disease.
You treat all aspects of health, really, the physical, the psychological,
That's
and
right.
the spiritual.
That's right.
In regard to health.
This is the total nature of the person. We don't just treat the emergency or the blood or whatever. We treat the total person.
How does one become a naturopath?
We have naturopathic colleges. There are 3 of them, well-established colleges in America, and we go through courses exactly the same as a medical doctor does. If anything, our courses in the basic sciences, or the sciences of diagnosis and therapies, goes way beyond the hours and time and intensive study that a medical doctor does. Now, I'm not trying to say, hey, look, we're better. The medical doctor goes way beyond in the practical things, and because emergency is a technique. So they spend their time studying techniques, and we spend more of our time studying cell physiology and the ecological factors and the nature of people and the nature of all the different types of remedies and things that can help people restore to health.
Are you saying then that the regular or the orthodox medical practitioner should relegate his time to corrective medicine, and that your time is I mean, is there a complicity, or can there be a complicity between the two? Can there be some harmony between the medical doctor and the naturopath?
Harmony, that has to come. It's inevitable. It's just about as much needed as in the automobile business. You got to have a man who does repair job, puts on spare parts, and the other man who does a tune-up job and makes the automobile run. And I believe that we are the tune-up jobs and the medical men are the repair jobs.
Could you be a little bit more specific and illustrate some of the types of therapies that you might suggest to somebody who came into your office with recurring headaches, for instance?
Current headache, that's a pretty general one, but it's a hard one to answer with a specific answer. But we would have to use sort of an elimination procedure. What are the causes? Always you try and find out what are the causes. And most pain in the body is caused either by pressure or is caused by poisons. I'm oversimplifying, but let's say that for the moment. We can study both. You could find out where the nerves are having a pressure on them, or you can do a total study of the person's whole lifestyle and just ask them what they've been eating, what kind of chemical environment in, were they close exposed to factory pollutions or whatever. It isn't that hard to find out that this person's life is saturated with poisons. Matter of fact, if you'd like a little better illustration, if you want to stop poisoning yourself, you're going to have to stop breathing like right now. Because every breath of air you breathe in this kind of civilization, especially in the big city, every drink of water you take, and every bite of food that you eat has some poisons in it. Then to make sure that you get a little more, you go to a doctor and say, what's wrong with me? And he gives you some more poison.
It could also be caused by stress or a lot
Exactly.
There are a lot of variables in that.
That's right. The mental and emotional abnormalities of stress are just as much toxic to the body, and they can have effects that are just as deleterious to the body in many ways as some of our drugs. So a negative. But we give the questionnaire to the patient at home, and they fill in the answers. They're doing it at their leisure. They're not tense. They're not being pressured by a doctor pounding questions across a desk. And the doctor gets the first answer back that occurs to the person's mind, and then on the basis of that he gives them a treatment, which is a little bit Russian roulette, I would say. We let the person think it over and come up with accurate answers. Then we do very intensive physical examinations. I may have something like 500 pieces of information on my physical examination charts. We do lab tests, we do biochemical tests, we do vitality tests, a health evaluation test of everything we can possibly think of, including even a characterology type of test to find out what kind of person that they are. Then we take maybe 15,000 pieces of information. And we find from the nature of that person that this doesn't fit, that doesn't fit. You don't put Ford parts into Chevy cars. You don't put drugs into human cells and this sort of thing, whether it's from a doctor's office or from a factory, unless it's an emergency. And we find out all of the things that are abnormal and where their systems have broken down, which organs are weak, which ones are out of balance, which ones are the deficiencies, which vitamin, which mineral, trace mineral, which chemicals are in excess, what stresses are abnormal, lifestyles are wrong, and then we try to map out of that a whole big regime that would suit that person and help them reach optimal levels of living.
Oh, it sounds like a lot of work.
It is a lot of work. As I say, I only handle 3 or 4 patients a day. I'll have 4 or 5 people in my office working on that. A nurse will take all those answers and transform those onto a big diagnostic